Morning. So this evening we have a couple of really cool individuals talking with us. We have Miss Kelly Russell, who's our program coordinator for the public health program. We also have Dr. McNair right here with us. She is an advisor for both public health and environmental health. And then we also have Miss Kelsey Webster, who is a public health advisor as well. So you may be put with one of those. Kind of just they split them up as they come in. And then we have Miss Morgan Barclay, who is a admissions counselor here in the university, who can kind of help us talk about and navigate through the admissions process. And then we have two super awesome students with us here tonight. We have Tyra and Simona, and they will both have the opportunity to kind of speak to you guys here shortly, and will answer any questions you guys have about student life. So with that being said, Ms. Russell, I will go ahead and turn it over to you.
Hi, everyone. Can you hear me? All right. Are you all good if I share my screen real quick? Okay. Okay, everybody can see our ECU campus in fall. We're almost there, except the fact that it's still 90 degrees right now. So if you're looking at coming to Greenville, do know that the weather can change by the minute, but we are looking forward to having you here on our campus. Now, if I were to ask, and I cannot see my chat right now, but I'm going to rely on at least Dr. McNair, Miss Webster, Mac, if you would chime in here. If I say purple, you say
gold.
All right, they know, so I hope that each of you know just as well. And again, if someone will keep an eye on that chat for me, that would be perfect. So if I said purple and you said gold immediately, my question is, what would you have come to mind if I said the term public health? And I think, you know, depending on where you would like to be, you could probably go multiple ways, from health promotion to analysis to epidemics. Most likely, some of you probably would have even said COVID at some point, because that's what the media has kind of told us has been going on in the last few years. So you'll notice down at the bottom, there's a link, and I'll place that in the chat when we get finished here. But public health is extremely broad. So I think it all boils down to you are interested possibly in our major because you want to help other people. How you help, it could be in a clinic, it could be in a work site, it could be in a school, a governmental setting, lots and lots of ways. So with that, we have about 40 faculty within our program. And if you were just to describe them in one word, I can give you a couple other ways that we can see what our students have said about our professors. They're knowledgeable, welcoming, inspiring, approachable. And I think that the way that our offices are even set up, we are kind of those open door individuals that are willing to sit down with students, talk them through their options because there are so many, and help individuals figure out how they will make that impact and how they will help in their own way. So with that, we've got 3 different tracks within our degree. And again, you leave with the same degree regardless of the track. So within that chat, if you have some of those goals and maybe an idea of where you would like to land, throw those down in the chat and we can go a little bit deeper into each one of the concentrations. If you don't know that that's pretty normal too. We have students that come to us many times knowing they want to help, but again, they're just not too sure. So some of those introductory classes, such as Health 2000, can really give you a good overview of what public health will entail. You can see our concentration areas include community health. And we'll bump down to worksite health, and each of these are going to help with individuals, maybe communities, larger populations, and then pre-health professions there in the middle is the one that's a little bit different because we usually see individuals going on to some type of a professional school afterwards. You can see some position titles here on the screen. Again, public health is so broad that these are pretty general titles, from epidemiologist to grant writer to health policy analyst. But again, think about how things change. I'll give you an example. My very first position title, I worked in HIV education. When I started working in the field, we really didn't see opioid prevention coordinators, and now that's a pretty hot area today. So with that, with the recent addition of COVID, we were able to see COVID prevention coordinators, individuals involved in response and testing facilities. So with that position title, sometimes you have to be a little bit unique, but that's where these introductory classes, and as you start to really determine where you would like to be, you can take some of those classes that will meet your interest so you can help others. Here are a few of the courses that are involved within our curriculum. You can see we have health disparities, program planning, evaluation. One of my favorites is community health strategies. I teach that course along with women's health. But over on the right-hand side of the screen, you see some of the skills that our students leave with, from community organizing, presentation development, and even that oral communication. So again, students that are working within our discipline will go out with very strong communication skills because you are working directly with the public. On the screen, you can see some of the layouts for our pre-health concentration. So I talked about community and work site to begin with, and each of those have a required internship at the end of the curriculum. So once all courses are met, the individual will go out into the field, and for a extended period, so in the summer it's 14 weeks, 11 weeks, and in the fall and spring semester it's going to be 14 weeks. Go out and work one-on-one with an individual, a preceptor that can really guide them through some of the things, and they can place into real-world practice what they learned within the classroom. Now, the pre-health concentration, and that's what you see here on your screen, has these areas that are built in the red circle: restricted elective. The individuals going on our pre-health track usually intend to go somewhere such as medical, dental, PA, PT, OT, some form of graduate school beyond the 4-year degree. And that said, they may have certain restricted electives where they can make sure that they are building in the prerequisites that they need within the 4 years of their undergraduate. You'll notice at the end there is not an internship. But to be able to go to medical school or dental school or any of these other professional schools, individuals need high GPAs, strong letters of recommendation, and lots and lots and lots of volunteering and shadowing. So with that, an individual is not doing an internship at the end, but instead we hope that they're building in their hours across their 4 years. I mentioned internships with community and worksite. Here are just a few of the internship locations that we've worked with. We do have students that choose to stay in Greenville, but we do encourage individuals to go out, especially if they have an idea of where they intend to land for their next step. Maybe go to that area so they can start building their network. We've had students that have interned abroad. So really the sky's the limit. We have approximately 40 interns out during the summer, all the way up to about 80 or 90 during each fall semester. Within our program, we do have a good number of faculty who are involved in research, and it's one more way that students can go beyond the classroom and engage further within our field. So you can see some of the students on your screen have been able to present at local conferences, national conferences, and even have some of their names included within publications. We have 5 ways for students to be involved now with student organizations. You can see Eta Sigma Gamma, that's our professional honorary society on your left-hand side of the screen. It's dedicated towards service and making sure individuals are involved in the community. On the right side, you can see our Preconception Educating Parents, so PEP squad, and that's really focused on maternal and child health outcomes. We have our BS Public Health Ambassadors. We have a newer organization called Her Plus, which is really focused on African American females and developing leadership within that population. And then we also have a new one last year, TACO. So TACO, and it's Team Awareness Combating Overdose. So it's really focused on making sure that individuals within our campus and also beyond the ECU community are prepared should they come in contact with opioids and things such as fentanyl. If any of you are from out of state, certainly you want to look at study abroad, but if you're even local, I can tell you this is one of the most enlightening things that we hear students talk about. So if you have the opportunity, consider this. And if you're out of state, it may even be cheaper to study abroad than pay for the credit hour since there's a flat fee. Each year, our Health Education and Promotion Department does a study abroad. And most recently, this past May, they went to Switzerland, France, and Italy, and they were able to go to the World Health Organization. They were able to meet up with several other groups. And again, really bring to life some of the things that we talk about in the classroom and also extend their network well beyond what we see just here locally. So public health is about everybody, everywhere, every day. And I think maybe as we get into some of our discussion tonight, we'll figure out how we can assist you in meeting your goals and maybe which of these paths is correct if this is where you choose to land. So I'm going to stop unsharing my screen and I'll turn it back over to Mac.
All right, awesome. Thank you, Ms. Russell. We had quite a few interested in like the pre-health profession, dentistry, that kind of thing. I think Dr. McNair had to step away, but really quick, I also wanted
She'll be right back.
Okay, so we can talk to her a little bit once she comes back on, but she also advises for environmental health, which is a degree in this department as well. And the environmental health degree is really kind of looking at and overseeing what is going on in our environment, how does it affect us, and what kind of interventions can take place that can students and professionals work towards to enhance well-being in communities. So perfect example is we have some faculty involved in mosquito research and mosquito vector-borne diseases. How can a population or area such as Eastern North Carolina kind of prevent mosquitoes that have these vector-borne diseases? We had a huge, the US did kind of had a little bit of a Zika scare for a while that plays into our public health profession of, making sure women who may be pregnant aren't bitten by Zika infected mosquitoes. But that is an interesting degree. And so usually we have students that kind of lean more towards public health, but environmental health definitely is a option as well. So if anybody is an environmental health student, please let us know. We can go in a little bit deeper. But I did want to go ahead and kind of allow our current students here to kind of talk about their experiences. So if you guys want to introduce yourselves.
Hello everyone, my name is Tyra. I am a senior this year. I'm a public health major with the concentration in pre-health.
My name is Simona. I'm also a senior in the pre-health concentration of the public health major. I'm also in honors college and I'm doing research here. This year is my second year doing research with Dr. Alice Richmond, and it's really cool because I feel like the faculty is very involved, and if you want to do something and you reach out, they'll be very supportive of you and point you in the right direction. Even if it's not specifically their expertise, they can show you where to go.
Tyra, what do you want to get into?
So I'm looking to, like they said, go into higher education as it pertains to medicine. So I'm looking into like med school, particularly in anesthesia or family medicine.
Simona, what do you want to do?
So I'm actually an early assurance scholar, so I will be headed to Brody next fall. I'm not entirely sure what specialty I want to choose yet, but we'll see when we get there.
And you guys are more than willing to kind of ask questions in the chat about whatever it may be. Do you want to go over maybe why you chose ECU?
I chose ECU mainly because of Brody School of Medicine. It was something that I was interested in, and I just wanted to have like that line of network of working not only on the ECU undergrad campus, but also being able to see how things are operated at the medical school as well.
I chose ECU, similar to her, being in the early assurance program, but I feel like I've gotten so much more out of it than I expected, especially with public health degree. I feel like the faculty are very nice, very open to helping you. When I was a freshman, I reached out to Dr. Richmond, who's my mentor now, and she was, right off the bat, really supportive, and helped me. And now this is my 4th year of knowing her, and, we're doing research together, and I think that really shows to, that the faculty actively care about your success and help you in any endeavor that you want to try out.
Tyra, you just did the study abroad. Do you want to talk about that a little bit?
I did just do the study abroad. I would say it was most definitely a great opportunity. I was able to learn so much from it and connect with so many people, just even within the public health field that I haven't seen before. So it was definitely an opportunity to put myself in a different predicament and picture myself as somebody who's going through different things than, what I would do here in the States. It was pretty eye-opening to, I guess you say, live like the Europeans and just be able to be on their route and do what they do in their daily lives. And it was quite interesting, and I felt quite involved in just being able to be at the World Health Organization, having conversations with individuals who work in UNAIDS, and just be a part, to feel a part of the world and feel like I can help someone. So I would say it's a great opportunity. If you guys are interested in looking into it, I'd say most definitely do it.
And I would say that goes across, any sort of degree program that you may be interested in. ECU has an awesome network of study abroad opportunities. So you can do things that are for your major, but you can also do ones that are kind of outside your major as well. Let's see, do we have any questions right now? I don't think so. Do you guys want to talk about a little bit more about what you guys are involved in on campus, maybe?
So involvement in campus, I'm actually currently a resident advisor in one of the dorm buildings here. I'm also a PEP squad co-president, and I'm also an ambassador. For the resident advisor position, I know it does sound like it's a lot, but once you have time management, it's easy to break it all down and figure out how to just manage your time and get to everything as much as possible. For resident advisor, it's a great opportunity to just connect and meet new people of different backgrounds. And sometimes you also meet people of similar backgrounds or similar pathways as you. So I'd say it's a great opportunity to connect, learn about others, just find involvement time to just be with the university and meet new people in different departments. PEP Squad, it stands for Preconception Educating Pirates. Like Ms. Russell said, we are a maternal and child development organization or student organization. We focus, one of our main things that we do is we have a parent pantry drive where we collect a ton of donations for expecting parents or parents that have just had babies. And we kind of just give support to them for our ECU community and just help them out in those ways. And then as an ambassador, or HHP ambassador, we just talk to you guys and educate you guys about, I don't know, just what we do, just how it is.
Yeah. So for me, I am an HHP ambassador as well. This is my 3rd and final year doing it. I also completed the maternal and child health STEP program, which is a 2-year certificate program where you take classes, you go to monthly seminars, and learn more about maternal and child health. And you can even go to conferences. There's money set aside for you for professional development if you want to go to conferences. Like last year we went to Boston for a conference, and I think it's a great way. It's definitely helped me kind of narrow down specifically in health what I'm more interested in, which is maternal and child health. And after being in that program, I decided to do research. So I'm doing a study on mothers in rural areas of North Carolina, and interviewing them about their experiences, how their whole birthing process was, positive and negatives, And the cool thing about that was that I was able to win some grants, so I was able to get paid for the research. And I'm also able to pay the women who I interviewed, so that's really cool. I mentioned I'm in the honors college, so that's really a cool community. We kind of know all each other around campus. And we kind of all started out together, and it's kind of interesting to see like where we all ended up. So yeah.
So that was a lot that we kind of just threw at you. So please feel free to share some questions. Miss Barclay, do you want to kind of go over any sort of admissions deadlines or anything students who are interested in ECU should know about?
Yeah. So I know you're getting thrown a lot of information, a lot of dates, so I'll just stick to the important ones. First of all, ECU is doing its own free app week. And that is on September 25th through the 29th. So you can apply through ECU's website or Common App for that one. And then CFNC does its own free app week in October. Let me double check that date before I tell you the wrong thing. And that is the 16th of October to the 20th of October for free app week through CFNC and also through ECU's website. So I know it's confusing. There's a lot of different avenues to apply through. If you get confused, you can always apply through our website for both and for both free app weeks and get the app fee waived. If you don't do the free app weeks, it is $75 application fee. I'm trying to think what else. And I don't want to throw a bunch of information at you guys. But yeah, so if you're interested, we have counselors for your regions. Feel free to go to ECU Admissions website and go to Meet My Counselor. You can put whether you're a freshman or a transfer, in state or out of state, and then you can pick by state and by county, and you'll get a specific admissions counselor for you. And then if you have any specific questions, those counselors are really well versed in those high schools and in those counties. So if you have any specific questions about languages and different requirements, please feel free to reach out to them. They are great resources and are great resources to help you every step of the way along application. And a little bit about Honors College. I'm not going to talk a lot about it. If you are interested in the Honors College, you have to apply before October 20th. So if you're interested in it, apply during either free app week is a great opportunity. There's no separate application. If you qualify for the Honors College, they'll get in touch with you and then they'll ask for supplemental information. So you just send your application in. If you're eligible, they'll send you additional information. So don't worry about that you're missing anything on that end. Any questions about admissions? I know it's a little early. It's September.
We are also just about a month away from open house. So that is a great free event. It's on a Saturday, October 14th. And you can kind of come explore ECU's campus if you haven't already. You can come by and meet us in person. I'll be there. Talk to the students there too, and even explore some of like the minors or other things you can get involved in on campus. I'm trying to think what else.
Yeah. We have campus tours Monday through Friday at 10 a.m. and 2 p.m. So feel free to sign up. We'd love to have you guys on campus. We have great tour guides that know more about ECU than probably anybody else on campus. So please come out to that. Also, if you guys can put in your first and last name in the chat, I have to mark attendance, just so I don't miss anybody. But yeah, any other questions?
You guys can ask us questions about where to live on campus, best place to eat. There's a common debate between Todd or Western Dining Hall. I'm personally a Todd fan. That's just me. What do you guys? Favorite place to eat on campus?
Weston.
Weston? Oh,
I
yeah.
like Todd too. I think Todd is better than Weston. Todd offers a lot more, it seems like the options than Weston does.
Yes, could be. Where did you live freshman year?
I lived in Ballard West.
What about you?
For my freshman year, I was in Ballard, but then we got St. Paul, and then I was in Clement.
So I was a Scott girl. I'm a two-time grad of ECU, so I was a Scott girl on College Hill. There's 3 kind of areas that you can live on campus. Trying to think what else. What are some fun things? Any questions you guys have about programs, about things to be involved in? I will say our college, like HHP as a whole, ECU as a whole too, but HHP as a whole has really kind of put forth effort to get students involved earlier, to get them involved in research, professional development. We even have a fund set aside for students to apply to kind of get that professional development experience. And we really focus on just hands-on experiential learning. So things that you're getting outside the classroom, you're going to hear from alumni pretty regularly who are in the field. We have an awesome alumni network. Trying to think what else.
Another thing is that as HHP ambassadors, we have an Instagram. And that is student run. It's all of us running it, and it's basically we post about events, activities, and we do takeovers, so you can kind of see what we do, each of us every day for a week, just going to class, having meetings, hanging out with friends.
You basically get like a behind the scenes
Yeah.
day in the life of like what it is like to be a college student. It's pretty fun. We have a variety of characters on there, if you will. But they're all really cool and provide some really good insight. But yeah, I just dropped those both in the chat as well. I promoted the public health account, so like you can kind of see some things that they're involved in, and the ambassador account as well. They also have Facebook pages as well. The ambassadors don't, but public health has a Facebook page as well, LinkedIn and Twitter. So if you're interested in those, we can share those as well. But if anybody does not have any questions, we are all good to go. We'll probably all stay on the line a little bit if you guys have some one-on-one questions you want to ask. But if not, thank you all for joining us this evening. And go Pirates.